Let's get 2 minutes on the clock, and of course your time starts now. A 12-year-old boy named Sam is brought to a rural GP clinic by his parents after being bitten by a dog on his right hand while playing in his neighbourhood. Sam reports that the dog, a large mixed breed, was unfamiliar to him and the incident occurred when he attempted to pet the animal. He describes feeling a sharp pain and bleeding from the bite wound immediately after the accident. His parents report that the dog ran away after biting Sam. Sam's last tetanus vaccination was 4 years ago. On his right hand, you observe 2 puncture wounds on the dorsum of the hand approximately 1 centimetre apart. Active bleeding has stopped. Question 1.1. What additional aspects of examination might suggest a more serious injury? List 6 additional aspects of examination. Alright, time is up and let's have a look at what some of the answers could be. So really focusing in on what this question is asking, what additional aspects of examination might suggest a more serious injury. Lots of targets here. So the big thing that we really wouldn't want to miss and would be worth definitely 2 marks is neurological deficit distal to the wound. That would hint at nerve involvement, which would significantly escalate our concern on this case. Likewise, and often overlap, we often say neurovascular, but in this exam we want to split those apart because they are different types of injuries, so evidence of vascular compromise, or with that you would probably also get away with mentioning things like duskiness or poor capillary refill distal to the wound. Again, 2 marks there. Of course, any evidence of joint involvement, and here there is a little bit of ambiguity as to exactly where this bite is, and that's intentional here. We want to make sure that we don't have a joint space involved, and probably tied into that as well would be abnormal range of movement or restriction in range of movement. Now, of course, if there's any evidence of bone pain, that last one would be worth 2 marks. If there's evidence of bone pain or traumatic fracture, that's going to get you another mark. And the way we would assess for that, of course, is pushing distal and proximal on the bony prominences around the wound. If there's any kind of tendon sheath involvement, you could argue there is some overlap here between abnormal range of movement, as mentioned before, versus this. Really what we're starting to look for are things like our tenosynovitis type injuries. Erythema surrounding the wound, again, looking for infection, warmth around the wound on that same front, or any pus or exudate from the wound. Now, you'd be pretty unlucky if so soon after a bite, again, the time frames are intentionally a little bit vague here, you have any of these signs there, but certainly something that you would be concerned about. And of course, systemic features of illness, so things like fever over 38 degrees. So we've got some answers here from the chat. So lots of finger active finger extension. Yep, fantastic. So that's the normal range of movement. Cap refill impaired. Visible tendon damage in the wound. Fantastic. Numbness of fingers. Yep. So I do like numbness of fingers, but I probably would aim to be more specific to mention exactly what you are concerned about there. And if you're having capillary refill, no, I think I'd accept that actually. I would say probably specify neurological deficit. Hypertension, tachycardia, signs of systemic illness or sepsis. Yep, fantastic. I think you would probably get that lumped in with the fever as systemic features of illness there. So well done. All right. Of course, we've got a part 2 to this question. So let's get 2 minutes on the clock and your time starts now. Sam's parents ask whether he'll need antibiotics, as his younger sister had a cat bite last year that needed some. What risk factors would increase the risk of wound infection requiring presumptive therapy? List 4 specific risk factors. Alright, time is up. Let's have a look at some answers. So the kinds of things, and this is again taken from ETG, which really is the Bible when it comes to finding out what we should be using where. So the things that would have us concerned here would be if the wound is a cat bite. Now, you will notice with this question, it just asks what risk factors would increase the risk of wound infection requiring presumptive therapy. It doesn't specify for this case, for this patient. So we do have that as a potential option here. So that's definitely worth a mark being, is the wound a cat bite? Presentation to medical care being delayed by 8 hours or more. I think if you were to just say delayed, you'd probably get half a mark. Showing that 8 hours or more is going to give you really that extra consultant level knowledge that'll get you the full mark or potentially even 2 marks in the actual exam. Now, if the wound is a puncture wound that cannot be debrided adequately, is also going to be in higher risk. You're more likely to have foreign contamination trapped inside that wound, which will increase infection risk, as well as if the wound is in a high-risk location, so hands, feet, face. If the wound's involving deeper tissue, such as bones, joints or tendons, as you probably noticed from the last question, someone mentioned, is there a tendon on view or involved? That's certainly going to increase your index of suspicion. As well, does the wound involve an open fracture? Of course, is the patient immunocompromised? Are they going to have potential for an impaired immune response that might mean they may not mount a proper response against even mild contamination? Or, of course, the patient has a high-risk comorbidity such as alcoholic liver disease or diabetes. So those last two, really we're talking about that immunocompromised state, and so they're likely to be grouped together. So I wouldn't be having both of those answers in the exam. Alcoholic, immunocompromised or asplenic individuals are going to be in that much higher risk category for capnocytophaga, canemorsis infections. So you're going to want to make sure that you're covering for those adequately. We have some answers coming in from the chat, of course. So joint involvement from the wound, fantastic. Previous solid organ transplant, excellent. And you're coming into that immunosuppressed state. Visibly dirty wound. Not specifically mentioned here, but I think I probably would agree in terms of a heavily contaminated wound. Yeah, that's going to get you a mark. As for extremely remote area, that's potentially a little bit risky. And I think I would probably go for other options just because remoteness, I'm not sure, given the increased availability of things like telehealth these days and the fact that this has been flagged, you'll be organising a review, I'm not entirely sure if that would get you over the line for empirical management. There is a real push for antibiotic stewardship these days, and so there is that reluctance to just prescribe antibiotics, and really we're trying to find more and more reasons why not to give antibiotics. So again, I would probably look for other answers first. Another answer here is delayed presentation, fantastic. Wounds on hand, feet, immunocompromised, all fantastic answers, and would definitely be getting you marks there. Very good. Okay, so we've got a part 3 to this question. Let's get 2 minutes on the clock and your time starts now. You confirm he has no known allergies. What pharmacological management would be appropriate? List 2 pharmacological management options. Doses are not required. All right, time is up. Let's have a look at some answers here. So for here, we're going to be looking at Augmentin Duo Fort as your oral antibiotic of choice if there's no contraindications, no allergies there. For just your learning, so it does say dose is not required, but I try to sneak into there as well just so you can pick it up. There's the dosing there you want to be using, so 22.5 plus 3.2 milligram per kilogram up to 875 plus 125 milligrams, so standard dose for adult. 12 hourly, 3 days. That'll get you 2 marks there because that's really the best thing to be adding here. Paracetamol orally. Don't forget pain relief. Simple things, being simple, and as I've said before, often analgesia and acknowledging pain as a contributor will get you marks there. So paracetamol or an NSAID or ibuprofen orally, both of those things would get you a mark. Now, take note, the antibiotic therapy as being the thing for it is going to be worth 2 marks, whereas those other things are going to be worth 1 mark there. Now, ADT booster, you will note that they've actually specified here that their ADT booster is actually within date, and so would not need the top up there, so the ADT booster would not be worth any additional marks. Sorry, it was a trap. I set a trap, and I can see some people have fallen for it. So we do have here Tetanus Prophylaxis Society ADT, sorry, and Augmentin Duo Fort, absolutely fantastic. And another response here, Augmentin and Nurofen, fantastic, fantastic. Well done, guys. I intentionally set some of these traps here. Yes, they're a bit pedantic, but you will see these things in the exam as well. So the more you can pick up on this kind of stuff now, this is the time to fall for those traps because you won't do it on the day.